the reason that I did this video and that I'm doing it now, before all of this happened, I was really struggling with what is this going to be like, and how will I feel, and what will I be able to do, and what's recovery like. And I Googled and I searched everywhere to find a video that could tell me what this procedure would feel like and what I was going to feel like and what was the process. And I couldn't find a video of anyone who looked like me, who was in my similar situation that I could relate to. And so I just thought, you know what, I'll make a video and maybe this will help someone else. So that's why I'm doing this. So if it's not polished and clean and all of those things that you want to see, sorry about that, because I've been in a little pain. But I really did want to make this video to assure people and to show them what this feels like. And you know, from that very first moment, it felt pretty good. I thought, oh well, this isn't so bad. Well, that was because you're still on lots of medication that, you know, is left over in the operating room. So from there, that first night, they pretty much say, okay, we're gonna let you rest a little bit, and then we're gonna try to get you up, because the goal is to get your body up and moving and walking a little bit. So within the first few hours, I was able to get up. I did have to use a walker to get out of bed. They teach you a specific way to log roll yourself to the end, and then to prop up, and then to grab hold of the walker. And so I did have to use a walker, with a nurse putting a kind of a safety belt behind me or around me so that she could hold on to, and to try to go through to the bathroom, because that's really important, being able to go to the bathroom, especially with this type of operation. They want to know that you can be able to go, number one and number two, and pass gas. That's really important. The first time, you know, number one was about all I can do, and that took a lot. The motion of standing up and then going down and then getting back up again, you don't realize how much those back muscles are involved. So that first night, you know, there was something that, you know, I think back on it now, and I was a little delusional, maybe because I was on the medication. I know they kept asking, well, where's your pain level? You know, between a 1 and a 10, what's your pain level? And I would say, I don't know, a 3? Well, now that I go back and look at kind of the scales, I know that was not a 3. I was up there. It hurt a lot. So that first night that I was in the hospital, tried to get some rest, but of course they come in and they check on you every 2 hours, which is absolutely wonderful, and that's what they need to do, and they should do, to check your vitals, to make sure that the medications are passing through you, and to make sure that you're okay. That's their jobs, and I so appreciate the nurses and the doctors who took care of me there. But throughout the night, they're checking blood, and I've got an IV in my arm. I'm, you know, trying to get comfortable, so we've got pillows stuffed all around. It was easier for me to sleep on my side. When I went in, the left side was the side that bothered me the most, but after the surgery, it was kind of the opposite. The right side was the side that was bothering me more. The next morning, when I commented on that to the doctor, he said it was because they kind of focused on the left side a little bit more, because that's where I had most of the pain. And so I don't really know exactly why, but that side has always felt a little bit better than the right side. So staying at the hospital that night, again, there's lots of checking in with the nurses. They're making sure that everything's okay. I was pretty much just eating ice chips. I couldn't eat anything from the day of the surgery, so I think the last time I had eaten something was the Monday night before. My surgery was on a Tuesday morning, and so I hadn't eaten anything at all. So it took a little while of finally getting something to eat the next day, sticking pretty close to things that were really, I was on a liquid diet for the most part, because they're trying to get everything settled. Hi Hi everybody, it's a day after my surgery. On the mend. Right now I'm sitting up and that's been helpful a bit, but it feels like everything is pulling, like the gravity is pulling towards my tailbone. I was able to make one loop around the nurse's station, so the physical therapist is going to come back and we're going to try it again. We'll see how it goes. The next morning, so the day after the surgery, still in the hospital. Again, they're teaching me how to get out of bed and encouraging me to, still at that point, I'm having to use the walker to walk a little bit and to get my body moving. So one of the nurses took me, just halfway to the nurse's station and kind of back just as much as I could walk at that time. So again, that was a little tough because your body feels like it wants to, but the pain is definitely still there. So that late that morning, that afternoon, they said, you're probably not going to be ready, so we're going to keep you another night, which was, again, really hard because during the COVID thing and no visitors, no extra people in hospitals. The only contact that you have are the nurses and the doctors who are there. About 6 o'clock at night, I just went on a short walk without the walker. The goal is to walk without the walker. I'm still feeling some pressure on the back side. With each step, it's a little tight, but I know that it's getting better. So don't be scared. So being under that realization that I was going to have to spend another night there was a little rough. But, in hindsight, it's probably the best thing because at least in the hospital beds, there were the railings that I could use to kind of pull myself over, or, I could get some help with being able to shift my body and the up and the down of the beds. And so, of course, I didn't want to stay, because it's never fun to have to stay in the hospital if you don't want to. None of us wants to, but it was something that was necessary. With each little walk, it gets a little bit better. The steps are tough because the muscles are tight, and going without the walker, it's a little bit of a white knuckle moment. But as I make my way around, I can feel it getting stronger. I'm not feeling the pain in the same area that I was before, and so that's encouraging. Right now, it's just really learning to trust my body and kind of getting past any of the feelings of dizzy-headedness or lightheadedness is encouraging. So I ended up staying there until the surgery was Tuesday. I stayed Tuesday night, Wednesday night, and then they checked me again checking to make sure that I can walk, and kind of weaning off the walker. If I could get out of bed on my own, if I could walk a few feet. The physical therapist came in and worked with me, and we practiced walking, and he encouraged me to walk around the nurse's station. We even tried to have kind of simulated steps because they asked, do you have any steps at home or do you have stairs? And I did have stairs, so we practiced doing that a little bit. And again, all of the while, I'm still on the medication that they're giving to me in the hospital. The first couple of days I had a drip that was in my IV, and I don't really remember all of the specific things that they gave to me in the hospital, but if I remember, I'll kind of put those on your screen. But the idea was to see if I was strong enough to walk on my own, if I could get in and out of bed on my own, and the number one goal was to be able to 1, 2, or 3, however you wanted to do those. So they keep asking you, have you passed gas? Have you passed anything? Because your body is just filled with all that medication, and it needs to come out. All right, here I am. It's 2 days out, and the pain was really bad this morning. I was able to sleep through most of the night. but when I woke up this morning, there were tears. It hurt quite a bit. I've been really stiff and still here in the hospital because they need you to pass gas and go number 2, and that's just not been possible yet. I've had a couple different painkillers, Oxy and Tylenol, along with Tums and some Atlanta, but things aren't moving, but it's just really stiff and really, really, really sore. So I know there's another side to this. I just gotta get there. Just finished with my PT. Was able to make a lap around the floor, go up a step to practice that, and go up and down a flight of steps using the railing. So it definitely does not feel good, but making progress, and that's the biggest thing. All right, they're gonna let me go home soon. I'm having a little bit of lunch before I go. I'm still quite a bit sore, but I was able to walk around earlier and show that I can get in and out of bed. So as long as I can do those things with the physical trainer, then I can go home. So soon. All right, getting ready to go home. I've been looked over and got my vitals, and everything looks good. Just still very sore, in a lot of pain, but it's doable at this point. I can go home and rest the same way that I could here, so looking forward to going home now. And he helped me up the stairs and got in bed. Again, that first day at home, I was still kind of on hospital medication. Great, just got settled back in at home in the recliner. Made the trip from the hospital to in the car. Hit most of the curves pretty easily without too much bump. Stopped off and got the prescriptions and a Sonic drink because something cold always feels really good. So now it's time to just sit still for a bit. And then moving towards the discharge medication and the things that they ask you to stay on a regular once you get there. So again, the first day home, the second day, the third day, there are times that I think, oh, this isn't so bad, but then the pain kicks in and I think, no girl, this is bad. This hurts a lot. It really does. The best thing for me, and everybody's different, the best thing for me was to stick to that medication regimen like clockwork. And again, because we had done something similar to this with my husband, we both knew that how important it was to stay on top of those painkillers and that medication so that your body never got totally to that point of just feeling awful. I think one of the side effects for me is dry mouth. My mouth is just so dry. It's just disgusting. After several days of using the prescriptions that they gave us, it's kind of funny because we both said, doctors, they're smart. They know exactly how long that you should be taking a certain type of medication. I was taking an Oxy medication, which, by the way, they really drill into you, and you have to sign off to understand how people can become addicted to Oxy. And so almost like clockwork, the last day of my prescription was filled for the Oxy, I started to feel really weird and would catch myself kind of hallucinating, and literally there was one time I could see myself sewing my hand and thinking, do I really have a needle and thread in my hand? It was weird. So that was the point I told my husband, okay.
Too early.
Okay, all right. Woo. Okay, gross out factor. That's what the bandages have just come off, so we'll be able to take a look and see how things are going. I'm going to stand up just for a second here so you can see one of the things that I have to do is to wear this back brace, and I wear the brace anytime that I'm not sleeping It's hot, it's uncomfortable, it can feel a little itchy, but I know that I have to wear it. The recovery time is 4 to 6 weeks, which again, it doesn't sound good. And I think 4 to 6 weeks, that's a long time to be wearing this and to be dealing with this. But when I think about the years that I've suffered from this and all of the people that I know who have back pain and who probably have similar situations and are afraid to do something about it, for me, the decision was I have family members who are suffering from a similar type of issue. My dad, and he uses a walker, he uses a scooter, and bless his heart, he's a wonderful person, and I can only imagine the pain that he goes through and has. And one of the things that he said to me was, he wishes he would have done something about it 40 years ago. And that kind of hit me, where I thought, okay, I'm strong for the most part, I'm healthy. I just turned 52, so this is what 52 looks like, y'all. So I just thought, you know what, let me do something about this now. If there's a way to fix it, or at least to help it, I don't want to live it with pain for a lifetime. So that's why I decided to do it. So again, this is a week out. I had the surgery a week ago today, and I'm getting there. I can walk around my house. I even went outside for a moment and stood to take a look at my garden to see if my family's been watering my plants that are out there. Kind of, sort of. It's tough. It's one of those things that I keep telling myself, I know that I'm going to feel better on the other end, but right now it's a lot. I have to remember when I wake up and I'm feeling good, not to think, okay, let me push forward, let me run around, let me do all sorts of things that I was doing before. No. By 1 o'clock today, it was time to go lay down and take a major nap. So I know that I'm going to be in this situation for another week or 2 or 6. It's going to be there is recovery time, because it deals with bone, and it deals with a major surgery that you've gone through. So I have to be patient, and I know that that's one of the things that's going to be really hard for me, because I want to be able to use my vacuum cleaner, and I want to be able to cook dinner, and I want to be able to do all those things that right now I just have to let people help me and do for me. And I know I'll get to the other side. It's just going to take a while. That's my story. I'm sticking to it. Again, I appreciate that you clicked on the link to find out a little bit more about a TLIF and what that stands for and what that means. Again, I'll write it out on the screen because I can't even say it. It's a TLIF. It's an intense surgery, and there is a lot of pain that goes along with it, but I'm really hoping that the pain will go away and I'll be back to being able to walk and run and play tennis and do whatever other things, roller skate. I want to buy some roller skates so I can hang out with my girls, and get back to doing the things that I'd really like to do and enjoy life without feeling the pain. So prayers, I'll take them, and I'll do the same for you. If this is something that you're thinking about and that you're going through. So I wish you the best, and I'll try to do another update to let you know how I'm doing and how the recovery process is moving along. So for right now, take care. My heart is with you. Thanks a lot.